Okay, we have the majority of people on the line now, so I'm going to just start with a quick housekeeping spiel. My name is Amy Donahue, and I'm Pivot's Manager of Communications, and I'm so glad to welcome you all to this Voices from the Field virtual panel series. We're really excited to have you. I just wanted to mention off the bat that we've had some people concerned with whether they are able to be seen on video, and I want to reassure you that no, we cannot see you, so no need to worry. However, we are recording this session, so the final recording will only show our faces, but we would like to invite you in presenting the questions that you have during this call to use your voices. So there is a Q&A box down at the bottom of your screen that should allow you to submit questions over the course of this call. We also had a number of questions submitted in advance, so we're going to do our best to get to answering as many of them as possible. And in so doing, we would like to, as I mentioned, ask you to speak them aloud. It's been really nice for us to be able to hear your voices. So if we get to one of your questions, Tara will say your name, and I will enable your mic capabilities, and then you can ask your question. But if you would prefer not to, feel free to submit your question anonymously, and that way we won't know who to call on. And I think that's all I have to say for today. So thank you again, and I will hand it over to our Executive Director, Tara, to moderate this call for us today.
Great. Thanks, everybody. Thanks for giving us your lunch hour or breakfast if you're on the West Coast, dinner if it's Madagascar time and you're hungry. We're really grateful to have you. I especially want today's session to be a conversation, so we're going to skip our prepared remarks, which we've leaned into the last couple of weeks, and go straight to conversation. You'll notice that there are a couple of familiar faces on the line. We're doing that intentionally. We have our Chief Medical Officer, Alishya, if you could give a wave. Our National Director, Laura Cordier. And Luke is there as our Acting Medical Director. Luke and Laura are together at our office in Rakotonirina. So those will be the panelists today, and I'm going to take just a moment to introduce Luke because he's new to the crowd. Luke has been with us since the very first day of the very first moment that Pivot began. We are so grateful to him. It's kind of fun for me to look back at those early pictures, Laura and Luke and a handful of people that we gathered in January of 2014 to bring to life the vision of a health system strengthening organization operating at district level to really try to transform the health system. And the people who took those early jobs, like Luke, were super brave, because NGOs in Madagascar, non-governmental organizations, many had left during the coup of a few years before, and jobs were lost during that time. And taking a job with an organization that barely existed, that was saying really ambitious things like, we're going to break the cycle of poverty and disease, we're going to transform the health system, we're going to do whatever it takes to save every life in front of us and build data and model systems to show how the world can follow in those footsteps. Those people were brave. And Luke is one of the bravest, and he's a really gifted leader. He started the ambulance referral system. He's a nurse, and he began the first ever ambulance referral system in Madagascar that has saved countless lives and is an amazing logistical feat. Because of course, most of the district where we operate has no road system. And so he has a coordinated system of stretchers and village phones and points along the rural road where the ambulance can reach and save your life. And he's been serving as our acting medical director for the last 8 months, really gifted in the coordination with the national government and the local government and keeping all of our teams moving on track. We have 181 people in Madagascar, the Pivot staff, and so that's no small feat. And Luke pays special attention to the community health program and the hundreds of community health workers who are really the front line of a COVID response or any response to health system strengthening, because so many people live far from facilities. So it is my great pleasure to welcome Luke this evening in Madagascar, to thank him for being there. Yay. And I'll just say quickly about Laura and Alishya. As you all know from joining us in past weeks, they've been around this block before. We've had measles and plague outbreaks in Madagascar. Alishya, through Partners in Health, was part of the Ebola response in West Africa. Pivot has been in this space before, supporting the national and local governments. And in many ways, our work is amplified during times like this, where the whole world realizes how important these things are and how interconnected we all are. And to that end, I'll just say we have a special place in our hearts for New York today, and the many places around the world that are the real epicenters of the outbreak. And we want to say that we're standing together with you, and we hope that what we can bring you in this hour is a little bit of hope. So I'll hand it over to you, Laura, to tell us what's happening in Madagascar right this minute, and then we'll go to questions.
Great. Thank you so much, Tara. So for those of you who are joining us for the first time, I will go over some of kind of the basics of where we're at in Madagascar and in the district of Ifanadine where we work. So as a reminder, the first case in Madagascar, confirmed case, was announced on the 19th of March. So we're now in week 4 in Madagascar, which I realize for some of you who are joining us from many other places in the world seems like very little time. Some other countries have been handling and dealing with this epidemic, this pandemic for months now. And so we're still in the early stages. To date, there have been 108 cases confirmed in Madagascar. And that represents 85 hospitalizations. 23 of those confirmed cases are now in the status of being cured and have gone home. And there have been no deaths so far. In our district where we work, which is the district of Ifanadine, in the southeast region of Madagascar, there have been no suspected or confirmed cases declared. However, we are very close to a small epicenter in Madagascar, which is in Fianarantsoa, where 7 cases have been confirmed. And so we're really in preparation mode as this gets closer and closer. As a reminder to everyone, our approach is one of accompaniment and strengthening the existing system. So we are really working closely with local authorities, whether that is the Ministry of Health, elected officials, security and military, at the district, regional, and central level. We're always trying to strengthen the existing system, strengthen the response to fight this epidemic in Madagascar. So our efforts today, we've worked on many different fronts, starting at the central level, I would say, which was our first point of entry. So we've got technical support in Tana. We immediately demobilized an ambulance to support with the transfer and the testing of patients. So we've got really our staff in the front lines of this fight, really concerned about their security, but also wanting to be there with the government to support the response in Tana. We have been working on sensitization, has been a really big one, and I know there are multiple questions that have come up that we'll try to answer today on our approach towards sensitization, but making sure people understand COVID, people understand the measures to take to prevent getting an infection from COVID and how to respond appropriately. We've been focused on preparedness, making sure the hospital, the health facilities are ready, and we've focused on triage and ensuring PPE is available and specific meds as well. We've trained health practitioners, set up a health checkpoint in the entry of our district. Those are many things that we've done to date, but I don't want to spend too much time on that. I know this is a conversation and not a monologue on my part, but I just wanted to update you on this week, what we're focusing on right now, as this situation is evolving every day. So our focus is right now in the hospital. We really want to set up the space in order to really be able to confine and isolate suspected and confirmed cases in a way that we're going to effectively contain and manage this epidemic, especially for patients who need hospitalization. We're working on community health worker trainings. We've had it's going to be a trickle down training. So the health practitioners at the health facility level are being trained to then train the community health workers on how to best support their communities and what happens in the case of a suspected and confirmed case in their community. A big turning point for us this week is mobile technology. We are deploying an application through ComCare to be able to do case management, COVID case management through mobile technology. This will really allow us to collect data on suspected cases, be able to localize contact patients, and also confirm cases. So this is really key for us, and hopefully can be a conversation and a basis for true research and interesting conversations around data and COVID. And we're also really starting to start a conversation and prepare for the eventuality of the first suspected case and confirmed case, and what are the steps and procedures we'll have to put in place, especially in terms of community isolation, testing, contact tracing. So it's a lot of work, and we're working on a lot of different fronts, but hopefully we'll be able to answer more questions.
Thank you, Laura. Okay, so we have a question from Jennifer Manzillo that I would like to direct to Luke. Amy, if you can unmic Jennifer. It's your question, Jennifer, about contact tracers. Do you mind to ask that one directly to Luke?
You can go ahead and unmute yourself, Jennifer, if you like. I just enabled your talking capabilities.
Oh, whoops, I skipped a step, sorry.
No. Okay, I'm not sure if that's going to work, so maybe we can just read her question, Tara.
Okay, no problem. Oh, Jennifer? No, okay. So Jennifer asks Luke, are you currently hiring any contact tracers or individuals to help sensitize communities about COVID-19?
Okay. To start, I'd like to thank you, Jennifer, for your question. This is a very good question, and I would like to say that right now we are working on. So to answer of your question, I would like to say that for now, don't forget that we don't have a confirmed or suspect cases. So we are in preparation mode for now. So about the contact tracing, I would like to say that we are in different scenarios. So at the beginning, if we assume that there will be a small number of suspect cases, we are proposing with the Ministry of Health to have an intervention team. So this team will lead the identification of contact cases. So they would have a representative of local authorities and Ministry of Health staff alongside private to ensure complete identification of contact cases. So as the situation evolves, and if the number drastically increase, then we will think on mobilizing more people for that. So that could be the private staff or CFWs or some volunteers, anyone else, as long as we can equip them with the PPE. So about the sensitization, I would like to say that we follow a similar approach where we are working with the local entities to raise awarenesses about COVID-19. So our experience is showing that this needs to be a continued effort. And now we need to make sure the information is going to farthest way villages. So thank you.
Yeah, one thing I'll add to the sensitization component is it's the first line, right? Especially as we're in preparation mode. And so it's the first thing we do, but we have to be able to sustain it. And it's a lot of effort mobilizing communities, especially as partial confinement is being applied and people are being asked to, go home after lunch. The life of a village changes drastically at noon. And so we need to make sure that we're not losing opportunities for contact and sensitization all the time, respecting the distance. So it's a really tricky time for sensitization.
And just to give you a sense of the remoteness, some of the communities we support are multiple days by foot or motorcycle from the nearest paved road. And so the way that those communication channels work is, of course, unique, and people like Luke are specifically positioned to be able to understand them and to get the messages to the farthest reaches of a Fanadine district. I'm going to move to a couple of questions about testing. I think it actually might be nice to group these for Alishya, to have these three people each ask the question around testing. And then Alishya, maybe you can give sort of a summary response touching on all the points. We'll see if this works. If it doesn't, I'll go back to my one-by-one plan. So Andrew Meldrum, Tiffany Bojic, and Laura Hall. Why don't we enable your mics and have you go in that order? Andrew, Tiffany, Laura, to Alishya about questions of testing.
Hi, this is Andrew Meldrum, and I am interested in the level of testing that will be able to be done. How will community testing be carried out in order to try and control the spread of COVID-19?
Thank you, Andrew. Tiffany?
It looks like we don't have Tiffany on the line after all, so I'm going to go to Laura Hall.
Okay.
Laura, you can unmute yourself.
Hi, can you guys hear me okay?
We can.
All right, first of all, I want to say it's really lovely to see Luke and Laura's faces. And I was just curious, you know, what the testing capabilities are and also how they're being used in Madagascar. I know in the US, you know, testing strategies are evolving and there's a 30% false negative rate. And so we're really using it with a caution. So I was wondering, you know, how that's rolling out in Madagascar. Thanks.
Thank you, Laura. And I'll just say that the addition of Tiffany's points are just to say that she's interested in testing and monitoring efforts in place now, but also plans for using those things in the future. So Alishya, over to you for a testing summary, please.
Yeah, sure. So thanks for these questions. This is a topic a lot of people are interested in. So just so we're all on the same page, I'll quickly describe the tests that are currently available, generally globally. So there are three primary kinds of tests that can be done for COVID-19. All of these have just been developed obviously in the last few months. So we're still figuring out kind of the pros and cons of each of them and their limitations. But the best available test at this time is something called reverse transcriptase polymerase chain reaction, or RT-PCR for short, and sometimes just PCR. So that is the test you've probably heard the most about. The way it's typically done is you take a nasal swab. You need a pretty sophisticated lab to run that type of PCR test. It's at least a biosafety level 2 for anyone who knows about laboratories. But basically, it's a high-level lab. You need pretty extensive capacity. And currently, the primary place where that testing is being done in Madagascar is in Antananarivo at the Pasteur Institute, and then I believe it is available at a couple of the larger hospitals as well. The government, I think, is working on expanding that capacity to other parts of the country as we speak. And I don't know the latest on exactly where that stands. Laura may have some more updates. We're actually having a conversation about this more tomorrow. And then the next type of testing is antigen testing. PCR is basically looking for nucleic acids or parts of proteins in the viral particles. And sort of similarly, what an antigen test is doing is generally most of them are, again, a nasal swab, and you're looking for little particles that are on the surface of the virus and testing for their availability. So the challenges with the antigen tests are that sometimes people don't have a high enough load of the virus in their bloodstream or in their nasal, or oropharynx, for those to show up as positive, even though someone's infected. Or conversely, if the person has been infected for quite some time and their immune response has been activated effectively, they've kind of cleared that virus, then you can also have a false negative there. Same thing with PCR, but PCR is just more effective. And then the third primary type of test is an antibody test, which people I think are hearing more about these days. antibodies are produced by your body's immune system in response to infection. And so it takes your body a certain amount of time to produce those antibodies after you've been infected. So the main challenge with an antibody test is that if you test the person too soon before those antibodies have been made, you can get a false negative. There are other challenges, but that's kind of the primary thing. So what we're seeing antibody testing used for more in places like the United States and Europe is seeing who might have developed immunity after already being infected. Due to the limitations on PCR capacity across Madagascar, we are looking more at antibody and antigen testing in the country. So the government has distributed, to my understanding, a certain amount of antibody tests to affected areas and to different districts, and I would plan to ramp the availability of those tests up as there are more cases in a particular area. And in order to supplement that, Pivot has also ordered 5,000 antibody rapid tests and 2,500 antigen rapid tests. And working with our teams and the government staff on what would be the protocols for how to use them most effectively. So I'll stop there.
Laura, I'll say, is our former medical director and a physician on the front lines in Boston. So Laura, let me let you and Alishya go a little bit farther into this conversation. I think having you tell us if that answered the question and whether there's anything more specifically you're thinking about with regard to Madagascar would be nice for people to get a chance to hear. I will add that Matt Vaughn's, our scientific director, is spending a lot of time thinking about testing as well, and especially about how important it's going to be, even if we don't have treatment, just to know where the disease has been in a Fianarantsoa district, to be able to protect communities where there hasn't been a case. Because we have measles and plague right now seasonally, things can be confusing. And we might even be storing samples that we aren't able to process for weeks or even months, because it still will matter. This sort of information crisis about what COVID looks like in a resource poor setting is going to matter for months. So I'm going to hand it back to you, Laura, and say sorry about my second grader joining us for a second. I think we're kind of all in this situation together where homeschool is like sometimes not going that well. Okay, Laura.
Yay, homeschooling. No, I would say that, you know, where I'm practicing is, you know, in some ways slightly resource greater, but in other ways similarly resource limited to Madagascar, and we're struggling with how to use testing. And testing is becoming in some ways less relevant because, so we're just doing the PCR test, and because it does have a fairly high, you know, the 30% false negative rate, it's hard to rely on that. And so it's helpful to hear, you know, we're not doing any antibody testing right now in the system that I work in. And so it's helpful to hear. And that's why I asked the question, to just sort of, you know, think about how Pivot is thinking about that, and how we can use it or not use it, and just sort of, you know, we're having a fairly high suspicion here for suspected cases based on symptoms and exposure. So I think that's helpful. I think testing is helpful, but, you know, in some ways less helpful. Yeah, so I'll stop there and turn it over to Alishya.
I actually would like to be able to add something, just because of the complexity of testing, and in reality, how we're going to be able to, what is it going to mean for a district like Fianarantsoa and like many other districts in Madagascar? Right now, it's going to, there are 13 rapid tests in the Fianarantsoa district, so that is gold. But there's that huge caveat that, as Alishya explained, there's a window where there's a lag, and we're really trying to accompany the government and the Ministry of Health right now in how to best use those 13 tests, because if you do them too early, especially with an antibody test, you're going to for sure get a false negative. And so really, because of that waiting period of either sending a test for PCR in TANA, or the risk of a false negative with an antibody test right now, we really have to focus on isolation. So the good news is we're really aligned in the vision that we have with the local authorities and the local Ministry of Health, that we're working on each commune having an isolation area, dedicating space that if there are suspected cases, because of the challenges with testing and that lag and estimating that it could take us 8 to 10 days before we get a true answer with, and even then they're false negatives, we would want to focus on taking no risks and making sure that those cases are completely isolated, and that we just assume that they're positive and launch contact tracing and a response at a village and Fukutani level. So it's a huge issue, and though testing is available, there are limitations.
Yeah,
I mean, I
thanks,
think
Laura.
that's exactly, oh, sorry, go ahead, Alishya.
Go ahead.
No, I was just going to say, I mean, I think that's exactly how we're thinking about it in a, semi-resource poor setting in the US is exactly that, is that, when testing is limited or results have some, higher result of false negatives, like we're definitely treating patients in terms of quarantine as, suspected / confirmed or presumed COVID, even if we don't have test results, or if we do have test results that we suspect are negative.
Alishya, let's have you give a final comment there, and then we'll move into some of the other questions.
Yeah, thanks, Laura. I would love to discuss this with you further later. But I just wanted to add a couple more points. I mean, I think as Laura was saying, management of suspected cases and their contacts is going to be key and is going to be quite complex. So that may be something we get into more a little bit later. But a couple more things I wanted to mention on testing that I didn't mention. There is also a gene expert test, which is another form of PCR test, but doesn't require the same level of laboratory sophistication that the RT-PCR requires. We do already have a gene expert in a district. I think many places in Madagascar have gene expert machines, and certainly that would be something that the United States they're going to have access, or we here in the United States are going to have access to gene expert testing much sooner than other countries will. I don't think it will be available broadly until probably August, but those tests should be available in the United States soon, and I think that is going to be really helpful. I think one of the things we're looking at is repeat testing, either doing a repeat test on someone a few days later if you think they have a negative test with either the same test or a different type of test, so that you can then increase your chance of picking up cases then if you think it's a false negative. And the last thing I wanted to touch on was the first question on community-based testing. So that's a really interesting question, and it's something that we've been discussing and we have interest in doing. I think at this point, our plans are limited to facility-based testing, but that may evolve as the situation evolves and as our testing capacity evolves with it.
Okay, thanks everybody. I'm going to move now to some of the sort of more basic needs and social supports questions. Luke, this one's going to be for you from Tina Curry. If you are still on the line, Tina, you asked a question about clean water and soap.
I just enabled your ability to talk, Tina, if you'd like to unmute yourself and ask your question. Okay, perhaps not.
No problem. So Tina's question, Luke, is that she would like to hear about how the lack of clean water and the cost of soap is impacting the ability to keep hands clean. I suspect she means that at the health center and the hospital, but also in communities. That's the main thing we're telling people here in the US, wash your hands all the time. So how are you handling that in Ipanadi?
Okay. Thank you for the question. I think that everybody, we know that hand hygiene is definitely one of the key issues for on this COVID-19. But where we are, lack of access to water is less of an issue, but access to a SOAP is definitely one of a challenge to these cases. So the key approach is going to be to ensure access through donation, for example. Other local actors are also looking for production of soap. And for now, we are focusing on training on proper hand washing techniques, knowing that access to soap can be an issue for this disease.
Yeah, at the community level, it's definitely going to be a challenge, but we're hoping that enough local actors are taking this as an issue, and you know, it's not a sustainable solution, but we're mass donating soap. But then I would say one of the nuances at the health facility level, as part of a triage setup, we ensure that before a person comes into a health facility, there is a spot for them to wash their hands, and that as this situation evolves, community health posts that are decentralized homes where community health workers work could also have that same concept, where each community health post has a spot where there's a little, you know, there's a setup where there's water and soap. But
Luke, you're going to tell me this is crazy, but in America, what we're doing to have people wash their hands for long enough is sing happy birthday twice. But the happy birthday song in English is too short. In Malagasy, I bet it's perfect. Would you do me the favor of letting Amy press record while you sing happy birthday, and then we can share that with the Pivot community as a new way to wash your hands? Or do you want to say, no way? The whole song. Sing us happy birthday, just as a quick intermission. People can get up and stretch, and then we'll go back to questions.
So, Arabaina Chachan Singer Tona Natera no ya no. Arabaina Chachan Singer Tona Natera no ya no. Arabaina Chachan Singer Tona Natera no ya no. Arabaina Chachan Singer Tona Natera no ya no.
I think it's 20 seconds at least.
It came in around 15 seconds, so pretty close.
Do a preamble. Beautiful. All right, Ann Miller, you're up next if you're still sitting with us and not singing happy birthday and washing your hands. Will you ask Luke your question about sensitization and the radio?
I think we've lost Anne, unfortunately. She was just on, but now she's gone.
Darn it. My question series is complicated. Okay, I'm going to wait and see if Anne comes back because I'd love to hear her voice. And I am going to skip to a question. Let's see. Let's go to Emma Gibbons. You have a question about linking organizations and updated information. I'm going to give this one to Laura, please. Emma Gibbons, are you still there?
Yes, I'm here. Thank you very much. Yeah, I just wondered about the network. Obviously, being down in Tulia, there's not that many organizations down here. We've also got Seed Madagascar and Fort Dufan that are doing some work down there. So is there a platform available to share information quite quickly, to maybe share resources, posters, material that's already been translated into local dialects, so then each organization then moving through areas don't have to then retranslate their documents. So is there any kind of platform available for that? Maybe Google Drive?
perfect. Thank you for that question, Emma. For sure, we're not the only ones in this situation, and our Director of Partnerships, Mathilde, is reminding us always that we need to enable more outward communication. So right now, it's true that we're in our Ranomafana Ifanadine district bubble. And so we're definitely ensuring that all local partners are a unit. So my first recommendation is be unified with all partners. And it's not just international organizations. It can be the representatives of water and forest. We're working with MNP, Madagascar National Parks. We're working with hotels. Everybody in this COVID epidemic is feeling very concerned and wants to help. And so it's about enabling and creating that community. So I don't know how it is for you in Tuliar. We're very lucky that the district committee here is very engaged and is meeting weekly. And we have proposed for local actors to create a subcommittee, especially if we're willing and putting forward finances to support the COVID response, to just make sure that we're all aligned on the same page in terms of the messaging that is going towards health practitioners, that is going towards the community, and also ensuring that our response is unified. We don't want one actor to do one thing and then the other to repeat another. So we're really trying to share resources and knowledge. Then at a broader level, I would say we are really lucky to have someone like Alishya and also Michael Rich, who's not here, but who has been on some of these panels, who are really helping us navigate the information warp that is the internet right now, and COVID, the evolution of COVID every day. And so I do see us as a potentially unique partner to create that platform in order, and we're open to share all of the resources that we've been producing and working on, and we're really advocating also to share that with the government. We're set in a unique space where we're both supporting at the local level, but also at the central level. Then of my knowledge, finally, to conclude, there are definitely existing efforts by other local entities. If you're not connected to those email chains, I strongly recommend it. The first one that comes to my mind is the French Embassy, first of all, has actually quite a well-functioning emailing chain of sharing resources. And they're not so strict with you being French. And it's also linking IPM as well. So that's a really functioning platform. PINGOS, which is also the Association of International NGOs, is sharing a lot of resources. MSF is sharing a lot of resources as well. And most recently today, we received an email from Action contre la faim, and they're also sharing a lot. So I think there are a lot of different efforts, at least in Madagascar, to share as much because we're only gonna, we all have the same objective, and so better to support that unity. The HPE network as well is quite a functional platform. So if those are familiar to you, I strongly recommend that you reach out to them, and then we can be in touch via Amy to share some useful documentation as well.
And Alishya, why don't we have you expand on this question in the international space, maybe talk a little bit about the PIH network, Partners in Health, and the Community Health Impact Coalition. Those are places we could maybe connect you for more information as well, Emma.
Yeah, definitely. So those other organizations wouldn't have resources in Malagasy, obviously, but so Partners in Health, I don't know if you're familiar with them or not, NGO based out of the United States that operates in about 10 countries around the world, including a handful in sub-Saharan Africa. They've been developing a lot of really useful resources. Tara mentioned there's the Community Health Impact Coalition, and that's a group of organizations that do similar global health work that all either focus on community health or have a community health component of their work. And so that network has actually gotten much bigger just in the setting of COVID. And I would say there are good resources that they're sharing, that Partners in Health is sharing. And then I think the other credible sources that I would suggest kind of on a global level are the World Health Organization. They have a lot of their materials in English, French, Spanish, and Russian. And then I know UNICEF is in the process of developing a lot of materials right now, which will be made public shortly if they're not yet available publicly. And then the last one is the US Centers for Disease Control, the CDC. There's an Africa CDC, which some people are less familiar with. And so they take CDC materials and make them more relevant for Africa. So one of the things that Laura referenced, Michael and I are doing right now is really sorting through all those different resources and putting something together that we think is most useful for the Madagascar context, and we'll be sharing with the government and with other partners. So those will be available soon, and that will be available in French.
All right, thanks everyone. I'll say also that when you think to those international organizations, Pivot is a partner to Partners in Health and a member of the Sheik Coalition. And those are places where everyone is asking the same question and trying to answer it, which is just what is this going to look like in developing countries where the age structure is quite different. 2 or 3% of the population in Madagascar is over 65, whereas in Italy it's much more like 25%. And so that's different. The comorbidities are different. People with underlying malnutrition or tuberculosis are quite different than underlying chronic conditions we've seen in some of the countries that are studied already. So the more that we can learn and support one another in understanding this pandemic as it moves through the developing world, the better. And people like Alishya, who've given their careers to this work, are guiding us. So hopefully she can be of support to you too, Emma. I'd like to move to Revo's question. Revo Nolson, it looks like you've asked 3 different questions. The one I want to bring up right now is your third question, which you say is about healthcare services, protection of health workers, question of where we're going to treat. Are you still on the line to ask your question directly?
We have Revu. I just enabled his speaking capabilities. You can go ahead, Revu.
Yes, can you hear me?
Yes.
Yes, and Alishya, this will be for you. We can hear you.
Okay, thank you very much for allowing me to ask questions, and thank you for organizing this conference. Yes, I wanted to ask a question about healthcare services. How do you ensure protection of healthcare workers? Since this is kind of new for Madagascar, and it sounds like most of the EPI that WHO and all the partners, because I'm among the international meeting, the international NGOs that are meeting in Tana here, it looks like they're having a problem in getting equipments to protect healthcare workers because the demand is very big in other places. So it looks like it's going to be slow to come in the country and for the government to coordinate the distribution. Do you plan to, the other question is also, do you plan to treat locally if you happen to have a positive, somebody have a symptom, or do you plan to evacuate patients? And where do you plan to evacuate them? I know that they have just trained some people from the hospital in Fianarantsoa, biologists, 2 biologists were just trained from over there, but I don't know how soon that hospital will be equipped to receive patients. Thank you.
Yeah, thank you, Revo, for those excellent questions. I guess I'll start with your last question, and I'll later turn it over to Laura because she can probably complete the answer better than I can, and then I'll go to the other questions you asked initially. So as far as management of patients in Ifanadine district, we obviously are a partner organization, and so we're working in close coordination with the Ministry of Public Health out of public facilities that are run by the government. So we will do whatever the government decides is most appropriate. I think for the moment, cases are, if they come up now, the plan I think is still to send them to FIANAR, but we're in conversations around having the capacity to manage those cases in Ifanadine district, working with the government on protocols for how to do that safely and plans for that. Maybe I'll pause there and see if Laura wants to add anything, and then I'll go to the rest of your question.
Okay, thanks, Alishya. No, that's exactly right. It's really gonna evolve, and I'll take something that Luke said previously. we are thinking in different scenarios. I repeat it every week, but it's so important. And I hope that the people who are joining us here and who are also actors working in this COVID response are also thinking in scenarios. So right now, the most probable scenario and the one that we're preparing for is if there's a suspected case, we will ensure that that case gets tested and that we will contain that patient until he's confirmed, and then we'll see what the government says. We're lucky to be so close to Fianar, and the CHU right now of Andranzatu is a referral center. And we're in a very close relationship with the CHU of Andranzatu. We've also donated protective equipment to them, as meager of a donation as it was a gesture to support them in this huge venture and effort that they're leading. And then the second scenario is once, and if the number increases of suspected and confirmed cases, and we need to start being faced, and not just Ifanadine district, but other regional and district hospitals need to start being ready to care for COVID patients, we'll be ready. And we're already setting up the hospital to be ready for that. And that involves really separate isolation areas and making sure that we're able to care for patients and protect other patients and protect the staff, as you said. So I'll hand over to Alishya.
Thanks, Laura. So just to continue on that answer, some of the pieces that would be necessary to manage patients, or even just screen them initially, as Laura mentioned, are already being put in place. So one of the things that we have been working with the Ministry of Health at various facilities on is an initial screening setup that Laura mentioned. So anyone who comes to the hospital, they are asked some screening questions. They have to wash their hands. They may have their temperature taken. And then the idea would be, and this is sort of moving forward, assuming there are cases in the district and we're managing them there would be a special triage area. So anyone who sort of screens positive as a potential case, just from a very limited screen, would then go to a triage nurse who would do a more in-depth interview, and probably also with a doctor. At that point, a test would be administered. Those healthcare providers would be wearing personal protective equipment. Those patients would be separated from the other general patients and the other healthcare workers not wearing personal protective equipment. So there's a whole quite detailed plan that we're discussing with the government that could be put in place to protect workers. And then assuming we needed additional facilities, additional isolation space to support suspected cases and confirmed cases, we've been working on plans for developing special isolation areas that would just be for COVID, potential COVID cases and confirmed COVID cases. So I'm not going to go in any more detail on that. But then the other question you brought up, and something that's involved in that, one, you can make plans, right? But two, you have to have the equipment. So we have been working on ordering additional equipment. We recognized early on that probably the government of Madagascar, just like governments all over the world right now, would have trouble getting enough PPE in. So we have ordered additional personal protective equipment ourselves. We do plan to share a large percentage of that with the national government so they can distribute it as they see fit. And then we'd like to keep a percentage of that equipment to distribute amongst the healthcare workers in Ifanadine district. And it's not just the healthcare workers, as I'm sure you're aware, it's the cleaners, it's the lab techs. We would like to have personal protective equipment also for community health workers. I think it's going to depend on how much we're able to procure. Whether or not that is feasible, and if not, then really implementing protocols so that they can do their work safely, and so that patients with other problems aren't suffering. And so it's the materials, it's the plans, and then it's training. So training everyone on how to do this effectively. I mean, just having PPE, I think we learned clearly with Ebola, is not effective enough if people don't know how to use it appropriately, because you can have full PPE and then you take it off and you infect yourself in the process of removing the PPE. So those are all things that we're thinking about and working with our Ministry of Health colleagues on. And, you know, we'd be happy to discuss this further on another call if you're interested.
Yeah, I will add, you know, PPE for, you know, the community and community health workers is something that's coming up a lot as well in Madagascar. I don't know about where some of you are right now, but in certain areas, you are asked to wear a mask, and if you don't, there would potentially be consequences, and it's a specific recommendation that has been made by the government and at least local authorities where we are. And as Alishya said, you know, there are a lot of also efforts of other organizations and to start distributing with, I would say, more handmade PPE. And we just want to make sure, as Alishya said, that we're also accompanying this with a lot of health awareness on best ways of using handmade PPE, of washing it appropriately, because we don't want it to then become itself a risk factor.
All right, thanks everyone. We've heard that Anne, who had a question for Luke, had to go to a different meeting, but I'm going to ask the question, Luke, on Anne's behalf, and I think this will probably take us through the end of the time I wanted to keep everyone today. If not, I see a question from Vic and one from Susan Wheeler I'd love to get to, but I'm committing to stop on time and give you a break before whatever you're doing at 1 o'clock. So Luke, Ann Miller's question to you is about sensitization, and she asks, are radio messages something feasible for those in the remotest parts of Fianarantsoa, and are they being used so far? So she's referencing interventions going out as radio and TV announcements to provide education and services in other parts of the world where she's working. Are you yet using those tools?
Yes, we are using those radio. And I'd like to say that in Fianarantsoa district, there are 2 functional radio stations, and we are using them in our sensitization efforts. But at first, sensitization was focusing during the market day, because every week there are a market day and around of the communes in the district. But as we are focusing on expanding coverage, we are more and more using radio's messages. So now I would like to add that our staff collaborating with the Ministry of Health in the district, we are drawing discussion around COVID, and talking about the COVID in general, and taking a specific question from the population around this disease. So the idea is to have an interactive discussion, a bit like this one, and also clarify the myth around COVID and clarify the facts. So that's it.
Yeah. And I think as, again, like as we're thinking about how do we get to the farthest person, how do we get that message out? I think people definitely have radio, and they also have those little radio carts. And, you know, TV is one thing, but not everybody in our district has access to TV. Radio is the next step, because actually quite a few have access to radios. And now we could also then, if we're thinking about going to that next level, I wonder if, you know, having a brain freeze in my French and English. Yeah, like pre-save specific snippets of information in these radio carts and then mass distribute them, I think could also be an efficient way. And we haven't gotten there yet, but this is ever evolving.
All right. Well, thank you everyone for joining. I'm going to wrap up by asking Luke to just share whatever is on the top of your mind, Luke, as you close out Wednesday, April 15th, and look to tomorrow and to the medical team that you're leading and to the protection of the people in Fianarantsoa district. What is the thing that your thoughts are focusing on the most?
Let me translate that real quick.
Yes. Leave the mic on. We like to hear it.
Okay. I'll leave it on.
Bilingual, trilingual staff.
Donc, aujourd'hui, ce mercredi 15 à 20h, à quoi tu penses? Cette situation, à quoi tu penses pour demain? C'est quoi ta priorité?
So my priority is like making my effort to help the government to respond on this COVID-19, and I believe that if we work together, I mean the pivot as an organization working with the Ministry of Health, if we work hand by hand and together, I believe that we can give more and more response to help the community to respond on COVID-19, I think.
Thank you, Luke. So thanks to Laura and Alishya as well, and for everyone who gave their time in this last hour. I'll just close with a reflection of my own, which is just that sort of every morning that I wake up to this new normal, I'm still astounded by it. I think some of the silver linings are really quite amazing. And then of course the tragedy is so real, but we have a funder who put forth an article that everyone in his portfolio is to read, and it's about writing a new playbook right now, that no organization should be operating as though they were operating a month ago. Even if you're a global health organization for whom this is your core work, you still need to be thinking about everything differently. And I would say in my new playbook, the headline is the world cares. We went from a scenario where my job used to be the bridge, tell the story, help people imagine what it would be like to live in a world where 1 in 7 children don't reach their 5th birthday. You know, these sort of like horrible things that we tolerate even in the year 2020. I used to tell that story. Join me in thinking about rural Madagascar and supporting Luke to change, to transform that health system. That everybody gets it now. The ubiquity of this is so humbling. And I just find that every day the starting point is different. We all are starting from a connectedness and a fragility and a shared ambition to see this thing over and to have stronger health systems and better resilient communities in the aftermath. And when we think of people without access to running water or soap, or how will food security needs be met if social isolation and quarantine is what's called for, I think there's still a special place in all of our hearts for that reality. But the starting point is different. And these voices from the field, opportunities are new. You know, I used to try to connect our community in the US to our community in Madagascar through an annual fundraising event where a few people would fly in and a couple hundred people would gather, and we would try to connect people in person. Or through inviting people to site visits in Madagascar, and myself to flying to have lunch with someone. And those things are just, those are from February. We're in April. Now we have voices from the field. And the beautiful thing about that is that now you can talk to Luke yourself. And I think that might be really something that matters to Pivot's mission over the long term. For us, this is a moment to really move forward our ambition around universal healthcare, around community health workers being counted as part of the health workforce, and really the people who can change the trajectory of health outcomes in a place like Madagascar. And if we can keep that momentum and sustain the health system while responding to COVID, we'll have done our jobs. So thanks for being a part of that. And to those of you who have supported our COVID response fund, a really special thanks to you for making room in your heart right now. And I'm sure you're helping your neighbors as well. And to everybody who's experiencing this personally and directly, our thoughts are with you. See you next week.